Rotational athletes don't get injured by accident. Low back pain in golfers, shoulder and elbow injuries in pitchers, hip and spine issues in rotational hitters. These injuries follow a predictable pattern tied to mechanical breakdowns, physical limitations, and overload in training volume. Today, I'm breaking down the real injury cycle in rotational sports and what every coach needs to understand. Over the past 2 decades working with PGA Tour players, MLB pitchers, and high-level rotational athletes, one thing has been consistent. The injury patterns are sport-specific, and they make perfect sense once you understand the mechanics. Golfers overwhelmingly suffer from lower back issues. Pitchers overwhelmingly deal with shoulder and elbow breakdowns. Hitters often present hip and lower back complaints. And here's the truth. These injuries aren't random. They are the result of mechanical consequences, physical dysfunctions, or simply too much volume. In other words, the body is compensating for something. Rotational sports place high torque on the spine, the hips, and the shoulder complex. And injuries occur when an athlete's capacity doesn't match the demands of the sport. There are 3 drivers of rotational injuries. Number 1, mechanical breakdowns, poor sequencing, poor force transfer, and inefficient movement patterns. Number 2, physical dysfunction, instability through the lumbopelvic hip complex, poor mobility, or insufficient strength. And number 3, overload. Too much volume, too many repetitions, and not enough recovery. Tissue breaks down when the mechanical load exceeds the athlete's physical capacity. Let's start with the lower back, especially for golfers. The primary cause of lumbar injuries are poor stability through the lumbopelvic hip complex. The core simply can't stabilize the forces created during rotation. Limited hip mobility, especially internal and external rotation. Lumbar extension during rotation. Athletes hinge through the spine instead of rotating through the hips and thoracic region. Poor lead leg deceleration mechanics. The body can't absorb force during the transition or follow-through. Golfers generate high rotational velocities with limited hip rotation. When the hips don't move and the core doesn't stabilize, the lumbar spine becomes the engine, and it's not designed for that job. Pitching places extreme rotational torque on the shoulder, and breakdown occurs when upstream segments fail. Poor sequencing forces the shoulder to produce velocity instead of transferring it. If the pelvis or torso stalls, the arm is forced to take over. If the posterior shoulder is weak, or if the scapular control is poor, the shoulder cannot stabilize the throw. If thoracic mobility is limited, the arm compensates by creating more motion than it can control. Mechanical overload shows up as early torso rotation, late arm timing, or the arm racing ahead of the body. Pitching injuries happen when the shoulder is forced to generate power instead of transfer it. Now the elbow, especially the ulnar collateral ligament. Elbow injuries spike when force isn't transferred cleanly through the kinetic chain. If the pelvis or torso breaks down, valgus stress at the elbow increases dramatically. If the deceleration system isn't strong enough, the elbow absorbs the load. If forearm strength, posterior shoulder strength, or core stability are insufficient, the elbow becomes the shock absorber. Mechanical contributors include early torso rotation, poor sequencing, and late arm timing, and trying to create velocity with the arm alone. Elbow injuries are the downstream result of upstream failures. And now the most overlooked skill in all of rotational sports is deceleration. Athletes accelerate extremely well, but most struggle to brake. The deceleration system includes the glutes, lumbopelvic hip complex, the posterior shoulder, and the lead leg. When these tissues can't control the forces created during rotation, several things happen. Energy leaks out of the system, joint stress skyrockets, soft tissue takes overload it was never designed to handle, acceleration without deceleration guarantees injury. Here is the predictable injury cycle in rotational sports. Step 1, mechanical inefficiency. Poor sequencing, poor force transfer, poor timing. Step 2, compensations due to physical limitations. LPHC instability, hip mobility deficits, strength limitations. Step 3, tissue overload from volume. Too many swings, too many throws, not enough recovery. For example, a golfer with poor hip mobility rotates through the lumbar spine and eventually the lower back fails. A pitcher whose pelvis stalls forces the arm to race ahead and the elbow or shoulder break down. Injuries happen when mechanics break down, the body compensates, and volume pushes it over the edge. So what do we do to fix mechanics? We improve sequencing and timing. We clean up rotational patterns so force moves through the chain efficiently. We improve pressure shift and lead leg deceleration. We teach pattern acceleration and pattern deceleration. And we ensure the athlete's movement strategy is efficient before we chase more output. You cannot out-strength train poor mechanics. Now let's talk about the physical side, where most programs fall short. We improve stability through the lumbopelvic hip complex. We increase hip mobility, especially internal and external rotation. We strengthen the posterior chain. We address thoracic mobility deficits. We build posterior shoulder strength for overhead athletes. And we manage total training volume so the body can recover. Remember, physical limitations create mechanical problems. In rotational sports, injuries aren't random. They're the result of mechanical inefficiencies, physical limitations, or too much volume. Fix the mechanics, build the physical capacity, and manage the workload, and athletes stay healthy and perform at a high level.